Doc Sally at Doc Sally General Medicine. I am here today with Dr. Nguyen. Dr. Nguyen is absolutely amazing, and she is our medical director here at Apple a Day Primary Care. And I'm going to let her tell you a bit about her life journey and why we are so thrilled to have her and how blessed we are to have her here.
Oh, thank you, Dr. Sally. It is wonderful to be part of Apple a Day Clinic. So in terms of my credentials and degrees and letters behind my name, I'll start with that, get that out of the way. My medical doctor training is from UC San Francisco, and my specialty is in family medicine. I did my residency here in Hilo. And, you know, rural care on an island in the middle of the Pacific, you really stretch the boundaries of what family medicine does because we don't have access to all the specialists. So it is really intense and powerful training to be a family medicine doc out here in Hilo.
I would agree 100,000%.
Yeah. Now, before I went into medical school at UCSF, I did Chinese medicine training at the Academy for Chinese Culture and Health Sciences in Oakland, California. And that was a master's in Chinese medicine, acupuncture, Chinese herbs.
Wow.
And
you did the herbs as well?
Yeah.
That's a lot of extra work.
Oh,
Yeah.
I love the herbs so much, yeah, which really makes me appreciate the Hawaiian la'au la'au and the traditions here. And then also along the way, I did a master's at the School of Public Health at UC Berkeley in California.
Really? I didn't even know that.
Yep.
Wow.
And so the awareness of the upstream effects of in our community, in the larger picture, is not just this person sitting in clinic right here in their issues, but everything on the larger level, their family, the community, the ecosystem that affects the individual's health. So those larger connections and looking at the upstream patterns of how we can better our community's health. And then in terms of my life story that brings me to this place, I was a refugee of war from Vietnam and grew up with a family who is very activist with refugee issues and with issues of people in need in general. And so grew up immersed in the arts. We would make big festivals every time there was a cultural festival, and my mom organized a Vietnamese language school. So very much personally appreciating that the community's health very much affects the individual's health, and that cultural health and cultural connection affects our individual health, and how we can be leaders in our community. And really that is part of my definition of healthcare, is really empowering individuals' leadership and our connection to each other, and how we can take leadership in our own lives and take leadership to improve each other's lives in that regard. So a physician is a teacher, and there are many teachers in the community, so we are all healthcare practitioners in that sense. So I continued from that upbringing of doing a lot of community activist work, and still very much am interested in the healthcare of those who need it most. And I think that's part of the reason why I gravitated to here in Hawaii, where there is a dearth of providers and some of the worst health outcomes in the nation.
Sure.
Really, especially among the Native Hawaiians.
Yeah.
So I'm really honored to be able to participate in this community and help in those ways. I love music. That's one of my medicines. I love Tai Chi and yoga. I love nature.
African dance? You teach African dance?
I do teach African dance. I love African dance. Lived for a couple of years in Africa and have studied for 30-some years. Yeah, so all of those things are part of my idea of healthcare.
Told you she was amazing. Enough said. Tell us why. Tell us what's different about this clinic from the other places in which you have been employed.
Well, this is actually the most satisfying and rewarding situation that I have experienced.
We didn't pay her to say that.
Because we really get to support our clients from multiple perspectives, with the best that the conventional medicine has to offer, and also the aspects that conventional medicine doesn't even train us in medical school. And much of that I am learning from Sally's expertise. So I really am so excited about the kind of care that we can offer to clients and the proofs in the pudding, the results that we're getting with people seeing improvements with tough chronic conditions that they have been struggling for so long. And with this integrative approach, we're able to finally figure out what are the root causes and what are the effective approaches for improving the outcomes.
And how can we get more care to more patients for less money out of the patient pocket? Because there's many patients that are paying $700, $800, $1,100 a month for their insurance and not using it at all because they didn't have a venue to go into that to be able to even get anything out that was relevant for their chronic condition. So now we can go, okay, so you have to come over here and do this naturopathic intervention that's not covered by insurance, but wait, these labs are really very useful and they're really expensive. Dr. Unity, what do you think she should do? And then that is covered by their insurance. So it's this wonderful niche that we created that serves people really well.
Really special. Yeah, really unique.
So that's what we're doing.
Yeah. I also see that it is particularly suited to the population in this area for a couple of reasons. One is that a lot of folks here are already seeking holistic and integrative approaches, and they have failed to find it elsewhere. And so it's a natural fit. And the other is that, I think it's culturally concordant in a lot of ways. Like the Hawaiian culture is already drawing on the la'ala'au, the herbal medicine, the lomi lomi, the hands-on. And so in the Hawaiian culture, there's already an appreciation of holistic approaches. And so I feel really honored to offer care that local folks will be more familiar with in a lot of ways.
Right. And you're doing acupuncture as well. So that's another way that we're integrating. So that's what we're excited to be offering. And here we are, doing it every day.
I want to mention that I love being in an environment where the culture of our office here is supportive of me taking the time to talk about diet and about sleep and about relationships and about meditation and all this, and not just pushing all the, did you focus on the prescriptions? Did you focus on these things that insurance reimburses for? So honestly, sometimes that means that we make less in insurance reimbursement for some of those things. We're not making all the markers of, I definitely am sharing the effective standards of care and offering people those different approaches. But when it comes to the person saying, hey, I want to talk about diet and I do not choose to go for these prescriptions yet, then I honor that and take the time to delve into those approaches.
And you're encouraged to do that instead of chastised for it or have your pay docked for it, which some clinics do. Honestly, if you're not productive to a certain level, then they, take people's money away. It's so sad that training is that pressure is like it's like being an MD in a lot of clinics. I see it as kind of being like a continual pressure grinder.
And at the same time, the research that leads to the standards of practice and the best practices that I can see clearly are the best approaches for people. We certainly honor all that research, we honor the best practices, and we offer all those things as well as the holistic approaches.
Right.
One example of how we work together for best outcomes for clients is hormones. And that is a topic that affects a huge chunk of our population.
Huge part of your life. Throughout your whole lifespan.
All the changes in your life. So I'm so honored to work with Dr. Sally because you've got so much experience with this very, very complex topic. And the labs, I have learned so much working with you. And luckily, I can help the patients to be able to access insurance coverage for these labs when
and
they
some
are
prescriptions. And some of the prescriptions too. Right. So making it something that is basically considered a little bit bougie medicine, and a little bit of entitlement required medicine, hormone management, bioidentical hormones, hormone replacement. These things are incredibly life supportive and lifespan extending things. and only a certain percentage of the population has access to them because of the care required and the prescriptions required. So we've been able to cut those costs by half, 2/3 for some people by doing integrated care through insurance, all above board, completely legit, by having the labs ordered and covered by insurance.
Now, just for realistic expectations, there are still costs with this because I am not the hormone expert as much as Sally is. So I have some experience with it, but when we get beyond a certain level of complexity, I actually turn to Sally because you've got so much more experience.
Right. Because bioidenticals and hormone management is really basically not taught in regular medical schools. It's definitely a specialty. Endocrinology, but first of all, is a specialty in the medical world, and natural endocrinology is a further subspecialty that they don't even approach. So even regular endocrinologists, if I send a patient to an endocrinologist, they're going to have a completely different experience than if we test, treat, and manage them with natural endocrinology. So you're talking about a specialty of a specialty, which is important to recognize that that's critical care for many, many people and complex care. But the outcomes are so astoundingly effective and positive that it's worth doing. So.
And it's so cool that in this little town of Pahoa, we've got just really world-class expertise in this regard. So I'm super excited about this.
Yay. Yeah. So if we're gonna, say if someone's having hot flashes, terrible hot flashes. Oh, I can't sleep. Oh, I'm drenched. Oh, it's awful.
Oh, that would make it more vivid. Yeah.
Oh. Right. So they go through the phone book or whatever that totally dates me. They go on and they find, Dr. Sally does hormones, and they come in and we do their first assessment, and sure enough we go, wow, you probably need some hormone management. And then I can go, well, I can offer you these lab tests, but they're going to be $60 to $300, or you can go to Dr. Unity and she can assess you and help decide all the labs and tests that you need. And guess what? Your insurance will cover both her visit and the lab testing. And then those tests come in, and then Dr. Unity goes over them with the patient, and then I have access to them too, and then I go over them with the patient, and then we come up with a hormone plan and a lifestyle plan and a food plan that supports the hormones. And we set you on a completely different path in life where your body can start to balance itself. So the prescription is really important, and it's part of it, but it also comes with a whole lifestyle plan to make those hormones work. And then, so they would come back to see me to do that and go off and do that. And then we would retest the hormones very carefully, including hormone breakdown products, because it's not just throwing a prescription at someone and just hoping for the best. We have to see what your body's doing with them and how your body's breaking them down. And are you constipated? Or are there issues that keep your hormones toxic or imbalanced or promote inflammatory pathways, which we don't want? So whenever you have something really potent, like a hormones are incredibly potent. The good part about that is you can move a case firmly along the direction of health with a potent prescription of hormones. But if you were doing them wrong and they become inflammatory, you can push an inflammatory pathway with them as well. So it's really, really important to do them well, to check carefully, to check the labs regularly, to check symptom survey. I have like a 4-page symptom survey. How are all these symptoms related to hormones? Most people have no idea how many symptoms are related to hormones, like skin rashes and psoriasis related to hormones. Did you know that? Not taught in school, but there you go. So we want those symptom questionnaires to come in and those symptoms to be getting better. And if not, we adjust the doses. They can take up to a year of adjusting doses to really get peri and postmenopausal women, for example, on a good hormone path. Once they're adjusted and the person's stable, it's much easier. But transitional times, perimenopause, andropause, those kind of things, they can take quite a bit of management, several visits to manage. So that's what we do.
Yeah. I also find it so fascinating that, let's say you have a low level of testosterone. Supplementing the testosterone is not necessarily the answer, because you want to know, is it because there's not enough production of testosterone?
Right.
Or there's fine production, but it's burning up too fast.
Right.
And if you just add more, you just
or are you binding it? Sometimes people have high sex hormone binding globulin, which is a lab which we can run. Insurance will cover it. Yay. And if it's high and you throw testosterone at someone, it does nothing. You just waste their money. It's so infuriating. And they don't get better because it's like one of those cars in the mall parking lot that's parked in the wrong place and gets that boot. You ever see the boot on the car tire? You come out, oh man. Not only is the car is there, it can be counted as a car, but it's going nowhere and it's blocking traffic. So if you have binding globulins, and thyroid can have them as well, if you have binding globulins that are high, you have to figure out why are they high? Why is the body trying to block these hormones? So you have to look deeper into that issue, because that's a very complex question. Why does my body not want these hormones? Why is it actively interfering with this process? You can't override that without possibly doing harm. And one of our precepts is
Do no harm.
see,
Yeah.
right? So it's sometimes inappropriate, and sometimes you can help people get the nutrients they need in the levels that they need to build their own hormones, and then you don't need to give a prescription. So prescriptions are not always the answer, but sometimes they are.
Yeah, so I love this high level thinking, because when I first started delving into the studies of hormones, it's like, oh, your testosterone is low, let's throw a prescription at it. But some people see no results, but they even worsen. And so I love that we are able to step into the deeper levels of the understanding, supported by the science of labs, often covered by insurance, not always, but a lot of it is, and to really see much better results than I've been seeing in the past.
Yes, and it's fun.
Yeah.
As fun as
Super
medicine
fun.
can get. It's pretty fun. Yeah. Okay. So a question was asked: who is a good fit for the clinic? What kind of patient or client would benefit the most from care at Apple a Day? And the answer to that is actually it's a really important question, because it's not right for everyone. This is not a one pill for one ill. Here's your vaccine schedule. Here's your do this. Oh, you got high blood pressure. Here's your pill. Don't think about it. Don't worry about it. Go back to eating at Verna's every day. It's not like that. You're not going to get the best from us. The people that get the best from us are people who care, who are kind of have the energy and the focus on their own care to actually apply a treatment plan to themselves, to actually make a change. It's not that we're asking you for radical change for your entire life all at once, but you have to be willing to make a step in a direction of change to make this kind of care work. So instead of taking a beta blocker for your blood pressure, you might be wanting to try to increase magnesium-containing foods in your diet. Or if that won't work, take a magnesium supplement. Give that some time, see if that's working. If not, add another intervention. So these plans that we create build on each other over time to create pretty significant lifestyle changes sometimes. So, and it's not a one size fits all lifestyle change either. It's not like we're telling everyone to go vegan or we're telling everyone to eat carnivore. We are customizing our treatment plans to the person in front of us. We're basically detectives. So think of us as your health detective. And we do really well with complex problems that other doctors or other venues just haven't had the time to approach. And the average medical doctor has between 7 and 14 minutes per patient per visit. That's what they get. You know what? 7 minutes is the national average, depending on how you count the type of visit. 7 minutes. That is not a lot of time to figure out someone who has multiple problems, these issues. So, and sometimes it takes us several visits to figure out what's going on, but we are smoothing it out and figuring it out as we go. So another aspect of a successful patient here is someone who's willing to make repeated incremental changes and visits so we can figure out each aspect of what's going on with them and kind of like peel the onion down over time too. So if you just think you're going to come in one time and be boop, 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 I'm going to get my testosterone and walk out of here, probably not going to be very happy with us. But if you want to look 6 months from now, a year from now, 2 years from now, 5 years from now, and go, I am healthier now than I was when I was younger, that's the kind of people that are going to be very successful here.
Yeah, absolutely agree. Folks who take responsibility for our own choices and who are open to gaining the knowledge that informs those choices are going to be the most successful. And habit change is not necessarily easy, and we are here to support those changes, and we have some insights into ways to make those changes easier and more successful, but it does take a lot of self-responsibility.
Introducing, this is Zipper. Zipper is a clinic service dog in training. She will eventually be certified as a clinic therapy / service dog, which is a service dog for the patients. So she is here for people who have a lot of clinic anxiety or white coat hypertension or white coat stress. We have a lot of patients that are afraid of medical care. They've had a bad experience. They're just scared of what's going to happen. They're scared of what's going on with their health. And the anxiety level comes through the roof when they even think about making an appointment. So those people respond really well to little golden doodles. And I even have patients who will call ahead of time and make sure that the therapy dog is going to be in the office, and they'll cancel their appointment if the dog's not coming. Like they're coming to see the dog, and I'm incidental to the situation. So anyway, so this is our newest little service dog. This is Zipper. And the question was, do people have access to care at Apple a Day virtually? In the private realm, for private clients, I have about 20% of my patients are virtual. And some of them I have never seen in person because during COVID, the telemedicine laws were suspended because of the emergency. So we were allowed to see people completely virtually. At this point, those laws have been reapplied. So to see a new person out of state virtually is not part of the law, what we're able to do as far as I understand. But if someone comes in even one time for a physical appointment to have a physical exam, at that point, then we can see them virtually for the rest of their care. So that's my understanding of how that works. And I would think that would apply to that Day too, as far as the law goes. I don't know, Dr. Nguyen, do you have a different opinion?
No, the policies seem to vary from insurance to insurance. And for some, it's that I need to see the person in person once a year. Or it really depends on the insurance. So if you want to be sure if you qualify for virtual visits, you can call your insurance and ask them. But yeah, I definitely have folks who mostly do by telehealth because some folks here don't have the transport or they don't have mobility. And so the care is really broadened and more accessible with the telehealth.
There are some things you cannot do with telehealth. It is not in your best interest to do them. There's so many things that are really important to know about someone who's doing physical exam and actually seeing them in person that you'll never get that data if you're only doing virtual care. So I'm not a big fan of virtual care for discovering what's wrong with someone. I'm a fan of virtual care for helping them maintain their health if we've already diagnosed a problem. So there's an important distinction there. So that's why I think it's really important to come once a year, or to come when there's something new, or to come if you've never even seen a doctor before and be seen in person. It's just good healthcare. We don't want to subsume convenience and make convenience the most important thing. Quality should be the most important thing.
Yes, the hands-on.
Right.
Even in Chinese medicine, the first things,
especially.
Yes, where the physical exam starts is when you walk in the door and I see your carriage,
which your
so
skin
the
tone,
color of your face,
right?
I hear your voice, all those things, super valuable.
Yeah, and there's a lot of naturopathic physical exam that is archaic that people don't do anymore because they're rushing around looking at iPads and lab results and MRIs and all that. And we miss some of the most basic, obvious things because we just don't check them anymore. And so we are maintaining and preserving those skills and trying to teach them to other doctors. And it's astounding the things you can find out and the things you can change rapidly from a simple physical exam that's done well. So we don't want to give up that.
If you are traveling here to see us, or even if you're local and booking, should you start with Dr. Unity or should you start with Dr. Sally? I think the ideal is to do both. Then you get the best of all the approaches. You get my expertise, you get Dr. Sally's expertise, you get the insurance covered stuff, you get the stuff that insurance doesn't cover, and that really allows for the most tools to be brought in for your health.
I'm encouraging my patients who have been my patients for years and years. I have patients that have been my patient for 15 years or more now, and I'm encouraging all of them to make routine wellness appointments using their insurance with Dr. Unity because we don't know what they're going to need when. And they need to be in that system, and she needs to be educated and informed about them and their health so that she can do what she does best as soon as they need it. So they don't have to wait to get in once something happens. So preventatively, it's also really important to do coordinated care in this particular medical culture. Coordinated care is the way to go.
And we have different trainings, different insights, so then you get to tap into both worlds.
Right.
Future visions.
Okay.
Something that is near and dear to my heart is making a lot of this information accessible to the general community, because some things I find myself repeating over and over to a lot of people where it's applicable to so many of our community members. And so I would love that. I love that you're doing this podcast. I have some things in my private Facebook group, and I would love to build that library of resources that are accessible to all the folks that are in the community who are ready to, who have impetus to take action already, even before you're able to either travel to come and see us or take time off your work to come and see us, things that are applicable to most people.
And I would like to do it from a functional medicine integrated point of view, because right now you can go on YouTube and find out what's the best alkaline diet and how to juice asparagus, and you can either find the Mayo Clinic's view of XYZ thing, or you can find so-and-so's super radicalized, supernatural view of XYZ thing, but you very seldom find a balanced, moderate, integrative approach that shows the pros and cons of each side of those arguments and suggests a balanced, moderate, healthy path. Like it seems like moderation seems to be a vanishing species on the planet. So sometimes moderation is exactly the thing that you need. So I would like it to be from an integrative point of view on various topics, what you can do for your health. And then if I need to send someone, you need to do this exercise, cardiac exercise trial. So there's a thing I do where for long COVID, for example, where people have severe exercise intolerance. They have a form of pulmonary hypertension, as you know, this post-COVID, and their exercise tolerance goes way down. And we can treat that really successfully with a variety of interventions that are really short term. So, for example, then I'll say to them, okay, pick your favorite exercise, go and do it until you first start feeling the chest symptoms. Stop, rest. The next day, do XYZ intervention. There's a bunch of things you can try. Repeat that test, time yourself. When's the first symptom appear? Report back. It's a really simple process. It's very moderate. We use certain prescription medications to make a difference in that, or we use nutrients, or we combine the two, and it's amazing. It can save you months of healing from long COVID. But I've explained that over and over and over again, and it would be so nice if there was a video that explained it. So that's what I would like to have going on as far as one step of collaboration. But eventually, we plan to have a large integrated healing center and possibly the country's first integrative hospital is our eventual goal. Small hospital, a rural hospital that actually has nurse practitioners, medical doctors, and naturopathic doctors working as teams to coordinate care for all kinds of conditions. And integrative dentistry will be part of that too, because dentistry is really important. There's one dentist right now for every 3,500 people in Pune. One dentist for every 3,500 people in Pune. Let's just pause for a minute and consider that statistic. So the need here is huge. And the desire for integrated care is also huge.
And oral health affects the whole system. Oral health
affects blood pressure.
A lot of things.
Right? There's a whole new study on oral health. Using mouthwash causes high blood pressure. There's a whole new study on this. It's a pretty strong study because it kills oral microflora. Oral microflora, when it's swallowed, goes into a state where it makes nitric oxide, which helps vasodilation. So no oral flora, no NO, no vasodilation, hypertension. Right?
Yeah.
Who knew?
Ooh, future visions. I'm also really excited about the day when we can incorporate a social work team.
Yes.
Because social needs are huge. Huge, yeah. We do have a therapist who's downstairs. Mental health is part of the picture. Not formally part of Apple a Day yet, but all those pieces so important to the overall health.
Right, and somebody's not just going to want to throw medication after medication without testing. Did you know you can test neurotransmitters? You can actually check someone's levels of brain chemicals before you throw a medication at them that would affect those brain chemicals. But does anyone do that? No, Dr. Nguyen is the only one that we would, right? So it's a very simple test. You dribble in a tube, you send it off to a lab, and it gives you this lovely list of your levels of epinephrine, serotonin, dopamine, norepinephrine ratios, and everything. And they are clinically reliable.
Let's talk more about that. You and I. Let's make a date for that one.
There's so much fun stuff we can do.
Yeah. If you like this vision, if you want to support, if you want to be part of it, if you want to benefit from it yourself and for your loved ones, then follow the social media. All the links are below. Subscribe to the channel, and we look forward to bringing you more good, juicy, healthy stuff.
Yay! We'll see you next time on Doc Sally Jungle Medicine. Aloha!